Everybody can see the slides. So good morning. My name is Michelle. My colleague Seth is also attending this presentation with you. We're going to talk about AXA Health, some of the good things that we have in place, some of our pathways. We also wanted to touch base on a little bit about AXA and a bit of background where we are in the market. Also, a typical broker's journey, which I think is really useful for an advisor. We also want to touch on what happens if you find that you're talking to a client that's appointed to a different broker and how you tackle that. And at the very end, Seth is very kindly going to do a demonstration of our quoting tool called Sigma. That will give you an idea of the individual plans, the type of benefits, and we will look for a volunteer. Hopefully somebody will kindly put their hand up and join in. If not, then myself and Seth will do a little demonstration of that. And at the end, there's a time for a sort of question and answer. Hopefully we can answer any questions that you possibly may have moving forwards. Okay, so moving on, you should be able to see the first slide, all being well, I'm hoping. Seth, can you see it? Lovely. Thank you. Just checking because don't want to start talking and find that it wasn't moving along. Okay, so a little bit about AXA. So you probably know we're part of the world's largest insurance company. You probably know it's a name that's been up and running for many, many years. AXA Health has over 3,000 staff, offices scattered across the country. Tunbridge Wells is our main office. We currently look after the lives of approximately 3.5 million. So that's across the whole book. So that's individual, SME and large corporate. AXA Health was founded in 1940. So been up and running longer than the NHS. We currently have 34% of the market share. Bupa is the top provider, currently with around about 37. And then the rest of the market is made up with Aviva and Vitality, and they're roughly about 12%. And then you've got some smaller niche providers like the WPA, Exeter, General Medical, Freedom, etc., that make up the rest of the market. A little bit about our SME plans. You may not know, but they start with a minimum of 1 employee. So if you have got somebody that's self-employed, please do have that conversation with us about an SME plan. The underwriting is slightly more favourable on a moratorium basis, but again, we can discuss that once you have the opportunity. Just to let you know that 47% of our SME business written last year was new to market, which means there is a really good opportunity for you. The average group sizing was just 9 employees. So again, doesn't mean that you have to be an expertise to be able to look at larger groups or anything. It just means that you need to have those conversations with your client. One of the good ones to open up a conversation is who is your private medical insurance with, rather than do you have. So just remember that when you're having those conversations. Okay, moving on. I thought it was really important that you understood the broker's journey. You may not know how the journey goes, but obviously you have that conversation with your clients. So that, do you have private medical insurance, or who is your private medical insurance with, preferably? It then goes on to do the market research, where you obviously obtain the quotations from the market. Quotes with us on an individual side are obtained through our quoting system called Sigma, which Seth is going to run through later. If you have any SME quotations, you also have a dedicated contact in our Bristol office. And again, please reach out to me if you're unsure who that contact is, and I can put them in touch with you. You also have an intermediary development manager, so they're there to help hold your hand, make sure that you are being looked after and fully supported. So whether it be a question on what do I need to get a quote, or do you know what, I've got a quote from the market and actually you're coming out slightly more expensive. Is there any pros and cons to where you might be better or not, as the case may be? So the intermediary development manager can help support you there moving forward too. No question is a silly question. Seth is one of our intermediary development gentlemen that covers sort of, would you call it the southeast? No, you don't really cover the southeast, do you?
Yeah, kind of southeast, but not including London. We break up different postcodes, so you can always come to me in the first instance, and if it's not a postcode that I look after, I'm happy to pass you on to a colleague, no problem at all.
Thank you, Seth. Obviously, the broker journey goes down the line of them providing or comparing the quotations. Obviously, you'd have had a chat with your client to work out what suits their demands and needs. Just to let you know that if you do have a member that's looking to join who's maybe slightly nervous or anxious about maybe a medical condition or something in the past, then members do actually have access to our underwriters, which again is something AXA prides themselves in, because not all providers will actually allow that. It just means that your client has that satisfaction that they know either that it's going to be covered or excluded, and just making sure that they're in the best place to take out the policy with us. I'm going to move on to the next bit because you have probably read what was on that slide. So a little bit about, once you've done the demands and needs, you've had that chat with the client says yes, you decide to incept the policy. Once it's incepted, the client normally will receive the documentation confirming who's covered, benefits, underwriting, etc., etc. It is in the members' best interest to double check that they're completely happy with everything that's on there. So, for instance, if they have decided to go and switch from a different provider, let's just make sure that it does show as a switch. That's most important. You as a broker then receives the commission. From a broker's point of view, you obviously have that relationship with the client. You would help them with any ongoing support. So I don't know, if they move address or they need to add somebody on or remove somebody, then that would be the process again. When it comes to claiming, I would step away completely. Obviously, you can advise your client how the claiming process works. So, i.e. that when they need to claim, they see a GP, whether virtual or their NHS. They then contact a provider, and the provider will then confirm eligible benefit and provide any pre-authorization that may be required. Reason to do this is to make sure that your client is looked after, so they know that they're not going to have any shortfalls. It also means that the provider is fully aware of what invoices is coming in, so that they can ensure that they are paid quickly and promptly without having to contact the member to get clarification over the said treatment. It's always important also to make sure that your client does reach out to the provider and make sure that they are kept aware of any ongoing further treatment or investigations. So, you know, if they ring up and they need a consultation, so normally it would be that the consultation and diagnostics is covered, providing they have the eligible benefit. When they have had that and they are then advised of the next stage, so whether that could be an MRI or it could be, I don't know, something further down the line, some further tests, then it is really important that that member does just pop a call in to the provider and get that clarification again. Okay, a little bit about renewals with AXA Health. So generally speaking, AXA Health likes to send out renewal terms 8 to 6 weeks prior to the renewal date. This allows you as the broker to have that conversation with the client to make sure that they are obviously happy. If you're wanting to have that conversation, probably a really good thing is, as you're aware, your renewal is due on whatever date. have you used the policy? How are you finding the policy? It'll actually open up the conversation with the client. So they may come back and say, oh, yes, do you know what? I've used the virtual GP, or yes, I had to have a consultation. It just gives you a little bit of knowledge about how they're finding the policy and whether it is actually meeting their demands and needs. Again, as a broker, you have some dedicated contacts that will help you, whether that be on an SME basis or an individual. So don't feel that you are ever left sorting the renewal out all on your own. You do have some contacts that will help guide you through the renewal process, and obviously any feedback from the client. Okay, so we know that private medical insurance is there to get that quick, prompt treatment of acute medical conditions. People often say, what are sort of the key exclusions? I think this is probably important. So there are many, many things on this listing, but as you can see, there are things like routine pregnancy and childbirth, which are not necessarily covered. The NHS is relied upon. There are different things like cosmetic treatment. Obviously, if a member is joining and they've had a pre-existing condition, then again, you may find that that is excluded depending upon how they are, how they join the provider. There's lots of other things. So if they're trying to use a hospital that's not necessarily within their eligible benefits, there can be different exclusions imposed for, I'm going to say, if a member decides to go fully underwritten and they, let's say, have had a dodgy knee, so that knee could be excluded. So obviously if they go to claim, they won't be covered for that. Lots of information around exclusions can be found within our policy wording, and I have put a couple of links on to the presentation. So if anybody needs to see those or have them, then please say, and I'm quite happy to share them. And again, if you've got somebody that's, I don't know, asking about whether or not something would be covered, again, it could be that a simple question through to the intermediate development manager, or it could be a little bit more complex, in which case it could need to go through to our underwriters. Okay, something I think is really important. So I've worked for AXA just over 8.5 years. Prior to that, I was an advisor. The most important thing as an advisor is probably knowing that you can take on the ownership of someone's policy, whether that be direct through a provider or through a different intermediary. Now, there is one form, which is called the AMI form, which is nice and easy to complete. So whether it be an individual or an SME, the individual or the group secretary completes it. It goes back to yourself for you to complete, and you then return it through to the provider. I have put details of our agency team on there. So for anybody that has that form, please send it directly through to them, because what they will do is they will authorise that policy attached through to you, and then make sure that any renewal terms and any communication that you have to have with us is completely up to date, and you will be able to do so. I would say, if you are having that conversation and say yes, they say yes, I do have a policy, and do you know what, it's not due for renewal for another 6 months, I would personally try and get that form completed as soon as possible. It just means that when the renewal comes through, you'll have the renewal terms, you will understand the type of benefits that they've got. It will just make your job a little bit easier when you're having those conversations with them. Okay, so I don't think anyone's hands have gone up, have they, Seth, before I...
No, I think okay.
No, right, okay, double checking that nobody's put their hand up and I've missed it, thank you. A little bit about some of our pathways, which are there to help members have that reassurance, which is what we probably know private medical insurance is there for, and to make sure that they're receiving that quick, prompt treatment. So the specialist booking appointment service is there. So members ring through with an open referral from their GP. Our specialist booking team can search the relevant specialist, hospital. They can, in some cases, arrange the appointment for them, or it could be that they provide some details through them to them so that they can book the appointment moving forwards. Our heart and cancer team, so they have numerous years of experience and knowledge. They have a really good listening ear. They are friendly, they are approachable, they are really, really hands-on. They want to provide the support to members having treatment. So whether that be private or down the NHS, they can reach out to them and have that conversation. So it could be something about discussing things like symptoms, it could be possibly treatment choices, maybe even how to eat well, or worst case scenario, actually trying to advise their maybe dependent children that they've actually been recently diagnosed. That can be quite difficult situation to go down. That line is also available not just to the member that's receiving the treatment, but also friends, their immediate family, just so that they can have that extra support. So I don't know, let's say that the main member is receiving treatment and the spouse is a little bit concerned that maybe they're becoming a little bit withdrawn. That spouse can actually ring through and have that conversation, and the team can very kindly provide a little bit of support, maybe over how to make things a little bit easier for the member that's receiving the treatment, but also for them, maybe some questions that they could ask or some ways of reassuring them. So a really, really good, important team. We have something called the 24/7 health support line. So this is where we probably all know we have niggles and concerns, and we're just maybe not quite 100% sure the route that we need to go down. So members have access to nurses, counsellors, pharmacists and midwives. Okay, so the nurses and counsellors are available on a free phone telephone line. Counsellors is really, really great. So if anybody that's maybe needing to talk to somebody that maybe hasn't taken out any mental health, then again, they do have some support by talking to the counsellors, and they will get the support that they need. Members also have access to people like I mentioned earlier, the midwives and pharmacists. You might be asking, okay, why do they possibly need access to them? Midwives, we all know since COVID, it's been quite tricky to get the support that members are actually requiring. So it could be somebody that's been recently told the good news that they're pregnant. They might be having some early symptoms, and they just want that reassurance. Or it could be somebody that's just come home with a newborn, and again, they have a question that they need to ask. We know how daunting it can be bringing up a new bundle into your house. I certainly remember when my two were there, I was just like, oh, this is a learning curve. So they are there to really help support them. Again, with the pharmacists, they are there to help provide some additional support. So it could be checking medication. It could be actually trying to fathom out a next step in any treatment that they may need. So again, a really good and useful type of telephone line for members to use. The second opinion service, people say, well, why would I need a second opinion? Actually, I think it can be really invaluable. So you as a member that's going through treatment need to make sure that you're 100% happy with your treatment plan. So it could be that you may have spoken to somebody, or you may have looked at something on a forum about that certain condition, and actually you want that reassurance. So what it means is that if any member needs a second opinion, they can have so. It doesn't come out of their consultation limit. So if anybody has a limit on their outpatient consultations, that will come out completely free to them. Just means the member gets that reassurance that actually, yes, what they're going to have done or proposed to be done is correct for them. Okay, some of the pathways. You probably know that AXA Health has a 24/7 online GP service. That's through Doctor at Hand. It's a 20-minute appointment that members can have. They can go online, they book their appointment, they can have upload, let's say that somebody has a rash or needs to show something, they can upload a picture on there so that the doctor can actually have a look and assess prior to it. What I will say is that 95% of AXA Health members are able to get an online GP appointment within 1 working day. It's really easy to use. It works around your work, it works around your life commitments. So just bear that in mind for anybody that possibly may need to see a GP. And any GP notes can be shared with their NHS GP, so to make sure that they're obviously kept up to date. So a little bit about our cancer pathways. So first of all, you have the breast. So we all know that if you find a lump or unsure that something is really not looking quite right, so our breast commitment is that we will see somebody within 5 working days at a location and date to suit them. They will provide any examinations, they will go on to provide any diagnostics. It is really easy, quick and simple. They don't have to have a GP appointment to use this pathway. It just means that members are receiving that quick, prompt treatment to make sure that everything is correct. Again, similar with the skin, it's a similar type of journey as the breast, that they have and are assessed, and tests are given normally within 5 working days. Now, the prostate is slightly different. It does take a little bit longer to be processed, and that's just due to the fact that members have to have a raised PSA level prior to actually coming through to use the pathway. So what would normally happen is if they have a raised PSA level, either from a GP or something like a health screening, then this is when this can come into place and members can be processed through our Check for Cancer team, who will guide them and even go on to book any other consultations or MRI scans, etc., that can be required. Our muscle, bones and joints used to be called musculoskeletal. So this is there for members to have access to a team of physiotherapists. There is no GP referral required. It means that members get that quick, prompt treatment. They call through, they are assessed, they may be given some exercises, or it could be that they're authorised to go through to somebody like a physiotherapist or a consultant. What I will say is muscle, bones and joints is one of our top claimants, so really useful to have. And we know that if these are not looked at quickly, then it can obviously have knock-on effects to other conditions which might not particularly be in favour for that member. So mental health. So this is available through on our SME plans. So it is another helping hand, I'm going to call it. So anybody that has an SME scheme who is over the age of 18, they don't have to have a GP referral. It just means that members can have that conversation, be assessed and directed to the appropriate treatment as quickly as possible. So again, you'll probably see all these pathways are there to make sure that members receive that quick, prompt treatment, which is what members want. They don't want to be waiting around. Okay, a couple of pathways which were introduced last year. So we have the digestive health, which was introduced in April last year. So this provides members with a specialist-led online support for any digestive issues. So it could be something from the esophagus down to the bowel. You will find that digestive problems are extremely common. Members do need to be over the age of 18 and have a GP referral to use this pathway. When I say GP referral, that could be our virtual GP, nice, quick, easy to get that appointment booked in. Now, this service is delivered by HBS UK. They are specialists with online servicing. They are part of the AXA group. They will provide the member with some questions that they have to answer online. They will then assess them, and then within 3 working days, they will get clarification back from the specialist as to the next source of treatment that may or may not be required moving forwards. So really good pathway moving forwards. Dermatology was introduced in August last year. This service is also through HBS UK. They do need a GP referral and they do need to be over the age of 18. And again, very similar to the digestive, members complete an online assessment. And again, they are given the correct source of treatment moving forwards, whether that be face-to-face or further tests, etc. Okay, we don't talk about this because we know everyone's route to better health is different. One person is different to another person. We do offer some gym discounts. That is either through the Nuffield or through Hustle, which is a little bit more flexible. It means that there's not things like cancellation charges. There's different activities that members can do online, etc. And again, if this is something your client is interested in, then we can share that information with you. Okay, some private hospital tours that I have been arranging. Seth has attended some with me. These are really, really educational and insightful. And you might say, why do I need to go and see a hospital? Well, actually, first of all, a private hospital is completely different to the NHS. They are quieter, they smell different, they run smoothly. When I say smoothly, you're normally seen at that time. You don't have the hustle and bustle. What normally happens is that you will get a little bit of information about the particular hospital that we're going to see. They will do an overview of the type of treatment that is available throughout their different hospitals. Then we tend to go and do a little bit of a hospital tour. So you'll get to see a typical outpatient room or an inpatient. You might get to see some of the technical machinery. You might get to talk to some of the consultants. So that could be something that does with cancer, or it could be some of the high-tech machinery, like the iron machine, which detects cancer within the lungs, which is available down at the London Bridge. There is lots and lots of information. It allows you to have that conversation with the hospital. It then normally happens that we have a really informal lunch. We get to talk to you, we can get to answer questions, and then we do a very brief sort of overview over some of the pathways, which mirror image up very nicely with the private hospital tour. And for you to be able to answer any questions, and also to get together with other brokers that may be in the same situation as yourselves. So again, if anybody is interested, please let us know. On the very last slide, there is a couple of email addresses for both myself and Seth. So please reach out and let us know, and we can obviously let you know any dates and locations that we have available. Beth, it's going to be your turn in a minute. So if anybody would like to very kindly volunteer to provide a little bit of information, so name, address, date of birth, you can make those up if you particularly want to, and just run through a typical quote. It will just give you an understanding of the type of questions that need to be asked and give you a bit of an explanation over the benefits moving forward. If anybody would be so kind, could they please raise their hand? I'm just going to talk about this slide here. So I've mentioned the support that's available to you, but we also have an awful lot of literature available to you. So you may or may not know, we have 3 individual plans. We have a comparison of benefits table, which clearly states and shows you the difference. There's lots of information about our virtual GP, our SME plans, and also if you wanted to do a bit of a marketing tool, we do have a PDF which you can white label and attach to any renewals, etc. moving forwards. Okay, is anybody's hand up? Or is everybody being really, really quiet? I'm just going to have a quick click. Okay. That might be a no then, Seth.
Don't worry, Michelle. I'll make it up. I'll make it'll be the first time I've ever had to do it, but I'll make it up. It's no problem at all. So let me just share my screen if that's okay. Did you want to come down and I'll share my screen?
I can't. It's not working. Is it working? Yeah.
Yeah, no, that's fantastic. Cool. And I should then be able to share my screen on here if that works.
I can see it, Seth.
Okay, fantastic. Well, very briefly, if nobody has any questions, I suppose that's the first question, really. Does anybody have any questions from anything that Michelle has spoken about? Nothing at all. Is everybody still there? Because we can't see anybody. We just see tiles. So make some noise. Yeah. Yay, we've got a hand up. Fantastic. Sonia, you're still there. Thank you. At least we know we're talking to people. Brilliant. Oh, right. Sarwan, thank you. Appreciate it. Okay, so today what I'm going to do is I'm going to run through a very typical quote. I'll be very brief with you. I don't want to get too technical. As Michelle's mentioned already, we're on hand to help. So when you have your client, it may be your first client, brand new client that's looking to review their current policy, that kind of stuff, you can always get in touch with us. We're happy to run this through with you on a case-by-case basis. Once you use the system a couple of times, you know the system, you're up and running. It's no problem at all. It's quite straightforward. So let's put something in here very briefly. And we will give them a date of birth of, I don't know, 01/01/19, let's say 1989. How about that? It's not so young anymore, you know. When I look at 89, I think, oh, baby, but actually not so young anymore. We need a postcode as well. So let's have a look at a postcode. I don't know. What postcode should we use? A typical area postcode of where you are. Let's try Stevenage. Shall we do that one? An SG1 1AG. Let's see if that's actually a postcode. No, it's not. I'll probably need one, won't I?
SG1.
Yeah.
5QQ. Try that.
Q. Let's try that one. That's the local B&Q, isn't it? So we'll add we'll just add a postcode to here. So that's quite straightforward. The only information that people need to do a quotation, other than the medical conversation that we'll have in just a moment, is really that information. So name, date of birth, and postal address, because it's obviously we will price our products based on the age of the person. And also the area that they live in. It's not because different areas have different costings because of people are more ill in those areas. It's more to do with the cost and care of drugs in those areas. So central London hospitals, for instance, will cost us a lot more money than maybe Huddersfield, for instance. So postcodes are quite important of where that member lives or where that company is based. So what we'll do here is we'll create an opportunity. This will tell us that there isn't anything already in the pipeline that we've quoted for, because obviously you don't want to duplicate. You can just use the same record. We'll create a brand new opportunity for this person here. There. So we got it quite straightforward. You can see that it's broken up into 3 areas. On the left hand side, we've got an information about the quotation, which is what we'll do first. At the bottom, under the members section, we have here, we'll talk about adding members, removing members, and answering individual medical questions. And then we'll put a quote together here as well, just to give you an idea of the level of cover that we do and what's best to talk with your clients about. So the first one here is on the right hand side, on the left hand side, we have it's already assigned to me, and as you would log in, it would be assigned to you. You can put a quote description in there if you wanted to, so we could say full cover, and then every quote that we do for this person, we can put a different number in, a different description in, and it'll be easier to find a bit later. Cover start dates. Well, obviously, if they've got a renewal on a policy, then that would be the renewal date, same as your car insurance. If it would be, we'd probably be working today for mid-May, maybe even beginning of June. Some of these policy documents are coming through now, so gives you plenty of time to ask the questions and make sure. Virgin opportunities, so brand new to market, not currently insured, first time buyers, if you like, you would do today's date usually. And if it takes you a few days or weeks for that client to come back to you and say, yeah, I want to go ahead, you need to remember to change that policy, because we can't backdate virgin policies. There'd be no need to do so other than to facilitate a claim, and obviously that's not something we can do. So we'll use it as today's date and we'll pretend this is a brand new cover. We have 3 different policies, and this can be sent out to you. There's comparison tables, etc. as well. But there's 3 main policies. There's personal health, health for you, and Inspire. There are slightly different levels of cover in each one, but the main difference between the 3 is the hospital lists that are available. Our personal health is our flagship product, and that's the product that over 80% of our policies are sold on, and this includes central London hospitals, so the Wellington, the Whittington, the Portland, Princess Grace, Harley Street, etc., all standard on our policies. I think what you find with our personal health plans is, even though the price might be, the premium might be slightly more than maybe a competitor, because it gives so much more, actually the benefits, the value is much greater. So it's not about who's the cheapest. Life insurance, it does one thing. If you die, it pays out. If you don't, it doesn't. Obviously, cost is probably the most important factor, along with a few other things possibly. When it comes down to medical insurance, it's all about the value. It's not about which is the cheapest. It's about which one is going to suit that particular client's demands and needs, and which one is going to give them the most amount of benefit value wise. So bear that in mind as well. We're going to say that this client is a brand new non-insured person, but if they are currently insured, this is where you would drop down, you would say they're currently insured, and you would tell us who their existing provider is as well. Sometimes we have discounts, so we do Marks and Spencer's vouchers, we do months free, we do all sorts of things throughout the year. We've just stopped a promotion, actually. We had a 2 months free promotion and that ran up until March. Currently we have nothing, but it would pop in that box there automatically if we then had a promotion on, for instance. So let's talk about the members. We have an individual member here. We've got his date of birth, etc. We would need to now answer some medical questions. So you would click on the edit member, and that will bring up that individual's folder with the medical questions and a few extra bits on there as well. You can see along the top all the information that we've already generated in there. We can add a few more if necessary, but we don't need to for quote basis. The underwriting, again, is very important. Because this person is a brand new non-insured person, the 2 choices of underwriting are either full medical underwriting or moratorium underwriting. It would automatically default to moratorium underwriting because about 98% of our new policies actually come in on moratorium. The reason for it, you don't have to ask the client the last 5 years medical details. They don't have to forget about something that they may not have disclosed that causes problems in the future. And also, after a moratorium period, those conditions would automatically be covered, and it's the same price. If you want more information about underwriting, got loads of documents on it, happy to give run-throughs, special examples and those kind of things. But you would usually find, most of the time, moratorium underwriting only for brand new people would be the best. Michelle's already mentioned this, and I think it's very, very important to note, if somebody has currently got medical insurance cover and you're looking to review and maybe move them from one provider to another, that would be what we call switch underwriting, or CME underwriting, continued medical exclusions. You really wouldn't want to re-underwrite somebody if they're currently insured, because you would start their underwriting all over again. They may not now be covered for something that they would have been covered for in the future. So one little tip: currently insured, it's switch underwriting. Virgin, probably moratorium underwriting. This is where you would also have the option to protect their no claims discount. So just like with car insurance, if they don't make a claim every year, then they go up a level of the scale. If they do make a claim, then they go down 3 levels of the scale. Unlike car insurance, they start about 3/4 up the scale, so about 70 something percent, depending on the answers to their medical questions. And protecting their no claims discount is always a good thing, because if they were to make a claim, they wouldn't then reduce that no claims discount for the year. So that's quite an important area. Slight cost to it, but again, good level of cover. We've got medical questions here, as you can see. Now, these are the only medical questions that we would ask on a Virgin scheme. And that is, anybody on the policy in the last 5 years have any issues with heart or heart problems, stroke, cancer, diabetes, and any mental health issues that have needed a specialist referral. So not just a GP mental health. If it was serious enough to be referred to a specialist, you would then say yes there. The last question there is about being a smoker. So smoked tobacco products in the last 12 months. Doesn't include vapes, by the way. It's a question I get asked very often. Nicotine vapes, we don't class as tobacco products. So if all they do is puff away at their vape, then they can say no to it. The only difference with that smoker question, it adds a slight bit to the premium, and that's all. As an ex-smoker, I would recommend giving up if you do. Anyway, we're going to say no to all of these medical questions. If there was a yes to any of those medical questions, Michelle's already mentioned this, direct access to underwriters. You pick the phone up, you speak to that underwriter and say, Mr. Bloggs in this case has had a stroke. It was this, it was that, it was this time. Will you exclude it? Do I say yes or no to the answer on the question? And they'll help you with all of that completely. As an example, with strokes, TIA or mini stroke, you may have come across. A TIA or a mini stroke, we don't class it as a stroke. So you would say no to that, make no difference to the underwriting at all. Okay, if it's a full-on blown stroke, then obviously you would say yes to that as well. So anytime there's a yes, pick the phone up and check with the underwriters that's there. And that's it. We don't ask about BMI. We don't ask about history, family history. We don't ask about drinking habits or any of those kind of things at all. So quite straightforward. Now let's put a scheme together for this particular client to make sure that they get the right cover and we know exactly what it is. So let's run through this briefly. Initially on our individual schemes, the core cover, the standard cover, covers inpatient, day patients, and CT, MRI and PET scans under the personal health cover. So that's all standard included. What we're looking at now is adding cover for outpatients. So that's actually seeing somebody, finding out what's wrong with you, maybe having blood tests and x-rays and those kind of things. There's 3 options. There's none, which is very unusual, but very unusual not to have that. Mainly people buy medical insurance to see a consultant first and find out what's wrong with them. 2 main options, really: standard outpatients and full outpatients. Now, we've stayed away from monetary limits as much as we possibly can with our policies. Most other providers will give you £500 or £1,000 of outpatient treatment. We try not to do that. So our standard outpatient treatment on our individual plan is 3 consultations and unlimited tests. So that member could go and see a consultant 3 times every year. It could be for the same condition, or it could be for 3 separate conditions, and they can have as many tests, blood tests, x-rays, EEGs, etc., than is needed for those conditions. Alternatively, if you've got somebody that's more concerned, maybe slightly older, or more concerned that they would need more than 3, then full outpatients, and as many consultations as they need, and again, unlimited tests. So we're gonna go for the top level of cover here, and then we're going to do what we would say ski downhill. If the premium was too much for the client, then we can start adjusting that premium accordingly. Comprehensive cancer is the next one. Now, yes, you can downgrade the comprehensive cancer cover to our NHS cancer support, which basically means If the NHS can deal with the cancer cover, the member goes there. If they can't, and it's something we would cover, then we would pick it up. I would strongly recommend not doing that unless they answered the cancer question in the medical declaration. If they've said yes to cancer in the last 5 years, that's automatically downgraded to NHS cancer cover. If they haven't said yes, I would again strongly recommend, but it's a demands and needs and conversation with your client, that you leave it with the comprehensive cancer cover. Makes little difference to the cost, not very expensive at all, and it's one of the biggest emotive conversations and reasons why people buy private medical insurance if they were to have the big things, i.e. cancer. So usually keep it where it is, but again, demands and needs and conversation with your client. We do have a travel policy. We have 4 travel policies that they can choose from. And at this time of the year, it's quite fantastic. Everyone booking up their holidays, which actually reminds me. But you book up a holiday and you need your travel insurance. We can add a travel insurance to this policy, and it's what's called a fit to travel policy. So that means it's a non-underwritten policy. As long as that member is going abroad and it's not going against the doctor's wishes, so they are fit to travel, they would be covered for everything while they're abroad. Even if they had exclusions on their main policy in the UK, they would still be covered abroad. But obviously, when they came back, the NHS would pick up that condition otherwise. So if you've ever tried to get travel insurance for somebody that's maybe a little bit older, maybe got medical conditions and it's quite expensive, maybe it's loaded, maybe they can't get travel insurance, again, a very good way, a very good place to add that there. It's an additional cover, so today we won't add it, but it is available to all members when you do the quotations. We do have 2 options here under the extended guided options. So our extended option is additional services that come at an extra cost, and that can be things like face-to-face private GPs. That can be no hospital list at all, so that member can go to absolutely any medical facility in the UK. And also we do hospital abroad as well, so not travel insurance, but elected overseas inpatient treatment. So if that member decides that they want to have their knee operation in Spain because they have a holiday home over there, we would pay the Spanish hospital the same cost that we would pay the UK for them to have their treatment abroad. Maybe they've got family in Italy, they want to be with their family when they have their operation done. That's the extended benefit. That's really for your high net worth clients because it does add a little cost to the premium. The most common option here is the guided option. Now, a lot of our competitors have something similar to the guided option, but I think ours is a little bit different. We don't tell that member who they need to go to consultant-wise. We give them the option of 3. So they still have the option of all the hospitals that we have, and we would give them the name of 3 consultants, and they can choose from one of those consultants. And that actually gives a big discount to the premium as well. That can be anywhere between 10 and 25% discount, depending on the member. So guided option, again, a very popular cover because we're not taking the choice away from the client. We're giving them the choice of 3. We'll leave that on for today. Therapies, musculoskeletal, muscles and bones. Very important cover, and a cover where if you haven't ticked the box, that member does only have cover while they're inpatient. So physiotherapy, chiropractor, osteopath, mainly physiotherapy to be fair. Tick the box, very popular. That can be standalone, that can be after an inpatient stay, that can be for anything. And again, on our personal health, we don't have any limits to the amount that's needed. So 10 sessions from a GP referral straight away, but if a consultant says that member needs to see a physiotherapist a lot more often to solve the problem, then we would authorize that treatment as well. So physio, chiropractor, osteopath, therapies cover, very important to tick. The other important one here is mental health cover. Now, mental health cover, again, on our personal health plan is unlimited or full mental health. We're the only one I'm aware of that doesn't put monetary or time limits on our mental health cover. Has to be fixing the problem, of course. difference between acute and chronic conditions, but we don't say 28 days or £10,000 worth of cover. We will allow as much as is needed to fix the problem. Now, mental health cover can be anything from cognitive therapies, so talking therapies, CBT, that kind of thing, all the way to a stay in the Priory if necessary. More and more cover I see. Actually, more people are coming to us asking purely for that cover, or mainly based on that cover, especially with young children, teenagers, etc. at the moment, because the provisions in the NHS for mental health, unfortunately, are massively strained. So mental health cover, again, quite useful. Dental and optical cashback. This is money back for going to see the dentist. Anything in the dentist chair, as long as it's not cosmetic. So a filling, maybe a checkup, a hygienist, etc. And then the optician's cashback as well. So we'll give 80% up to £400 for dental and 80% up to £200 for optical. So that can be changing in your glasses, for instance. We also give a 25 or up to £25 for a checkup, an eye test every year as well. So that's quite a useful level of cover to claim back. So we'll add that as well. And then obviously we've got the excess. Now the excess for us is different to car insurance again. Excess is per person per policy year. So once they've paid the first excess, if they have 3 or 4 conditions and need to see consultants, etc., it's only every year. It's not every time you go and see a consultant. We'll put £100 excess on there, but quite typically 100 or even 250, sometimes £500 excess is there. We do have higher excesses, very few and far between, £1,000, £5,000 excess. You would need to have a really bad condition to have to pay the first £5,000. Reduce the premium though. So let's stick at £100. We'll tick a couple of these little boxes here just to make sure that we've got everyone's permission. It's a made-up person anyway, so I'll give them permission and we'll click quote and we'll see what that comes out to. Now, don't forget, this is an absolute top level of cover. This is a 36-year-old person living in Stevenage, so a standard person, I would suggest. And the premium there monthly is £132.04 a month. That's full outpatients. That's comprehensive cancer cover, that's full therapies, that's full mental health, that's pretty much every cover that they need. Again, ways to reduce this if necessary. We can look at going to full down to standard outpatient. We can up the excess. We can take off the dental and optical and the mental health. And that's a kind of a mid-range policy, if you like. And then we can put a quote for there as well. And this will then come back to us with £65 per month for that person there as well. So well within, probably cheaper than a gym membership. And don't forget, we give up to 40% discounts on gym memberships as well, so that may help. But £65 a month for that kind of level of cover is really useful. The reason I went through a couple of quotes, just clicking up here, you can look at your quote history and then you can put down here, you can see all the quotes that you've done so that you can go back in when you need to and buy one if necessary. So let's say that member decided they wish to go ahead with that quote, then you can quote it again, you can then send it to yourself, purchase it, go through a few screens, put the client's bank details in, and that policy goes live straight away. So there's no waiting for GP reports and applications and underwriters, etc. It's all done on a moratorium basis. Is the client happy? Have you explained everything? Click the button and they're on cover. So has anybody got any questions?
I can't see anything in the chat box. Can you just pop out and I'll just pop back in before we just do live Q&A if anybody has any. Well, it's okay. Well, okay. I'm just going to go to the very last couple of slides. So I just wanted to do a little recap over proposition, 3 individual plans, 2 SME plans. I've mentioned the USPs and the pathways. Seth very kindly mentioned some of the ways of reducing the costs, the guided option, excess, and paying annually. If you do pay annual or looking to quote annual, that will include the 5% discount, so please don't take it off. There is a couple of portals which are really helpful. So the broker support is really, really useful. Lots of information, literature available to you, and we can share the link. If you want to see our monthly newsletter, so there's a broker support extra, again, that's quite easy to sign up to. Sigma, Seth very kindly touched on. I would talk to group leavers and retirees if they've had private medical insurance. It's a really good one to tap into because they're likely to want to continue. We do offer child-only policies. And the other thing is also to just let you know that we are here to support you. We don't think that spending an hour with you is necessarily enough. So please reach out. We can break down the training. We can have a conversation over you, your business, the type of clients you have, and we can come up with a good training scenario to make sure that you are supported and that you are confident in talking to your clients. I'm just going into the chat. I can't see anything in the chat. There are two that still have their hands up, but I'm not sure if that was questions or whether they just had the hands up from waving to you, Seth, when you were doing the demonstration.
I don't mind. Anyone can wave at me. Wave back. It's no problem. So if there's any questions, please let us know. Come on your camera or type it into the chat now. If not, thank you very much indeed for your time, and I hope it's been useful.
If anybody does have anything, then there is mine and Seth's email addresses down. Please pop them across to us. We can help pick up one-to-one training, or if you just want to have a chat over anything that we've discussed on a one-to-one basis, then please let us know. Thank you.
Thanks,
and have
guys.
a good afternoon.
Thank you.
Thanks. Bye-bye.
Bye-bye.